Like decode the question here. A 69-year-old white male with a past medical history of COPD, present with ED, complaining of blood in his urine. There is an hematuria, right? What they are mentioning? There is a scenario of hematuria and no pain is mentioned. So we can think about it's a painless type of hematuria. Painless hematuria, nothing is. And difficulty in voiding. So voiding issue, think about, right? Either bladder issue, right? We'll come more about it, or some urethral issue, right? A complete blood count reveals hemoglobin of 9.8. So decreased hemoglobin, right? So it means there is a chance of anemia. He is losing a lot of blood. And platelet count of 1.5. There is a high thrombocytopenia also mentioned here. The most important thing, they have done a biopsy. So the suspect was a tumor or cancer. They did a biopsy. And what biopsy is showing? Exophytic papillary growth pattern. So bladder, painless hematuria, anemia, exophytic papillary growth, right? So urothelial or urogenital or urinary difficulty with in biopsy report exophytic papillary growth. This is enough. We can think about, they are talking about transitional cell carcinoma of the bladder, painless hematuria, anemia, exophytic growth. Everyone know bladder cancer can be what? Transitional or what? Squamous. What is the most common one? Transitional. Either there will be exophytic or endophytic nest-like pattern. So they have mentioned here. Right? And they are asking what can be the reason. Oh, this is in a painless hematuria. So blood, the problem is what? The urogenital area. We think about something about bladder. So let's decode all the options. The correct answer here is naphthalamine, or we call it as aniline dye. But before coming there, let's decode everything. See, given here arsenic. From which people we will see arsenic? They are seen smokers. Right? Smokers. What arsenic exposure causes to us? Long term, they will cause you squamous cell carcinoma of the lungs. They will affect the lungs, as well as they will cause you angiosarcoma of liver. Which one? Arsenic. Lung cancer and angiosarcoma of the liver. Nitrosamine is very famous. That's why many students have chosen that. You remember Japan. What's the problem with the Japanese people? Every day they are working. They need advancement. No time to make food. They depend only on what? Fast food. Remember like that. They use fermented products most, or like smoked food. Fermented or smoked. So if you see that, think about Japan. Right? Fermented or smoked food. They will always cause you stomach cancer. Stomach cancer. Anything about stomach mentioned here? No. Then vinyl chloride, those construction workers or factory workers who exposed to PVC pipe, what? PVC, polyvinyl PVC pipe. Same thing. They also cause us angiosarcoma of the liver. Nothing mentioned here. Right? Other option here is aflatoxin. This comes from a famous fungus. Anyone? What is a fungus? Aspergillus. Good. Aspergillus. So which fungus is that? Aspergillus. And they will cause you hepatocellular carcinoma. What they cause? Hepatocellular carcinoma. Then the question here is about naphthalamine or aniline dye. Same thing. They are also coming in smokers. Smokers. Most important, they will cause us what? Bladder cancer. So what is the motto of this question? To know the main important what? Carcinogen. So let's repeat. Naphthalamine or aniline. What cancer? Bladder cancer. Nitrosamine. Stomach cancer. Remember Japan. Arsenic. Squamous cell carcinoma of the lung, as well as angiosarcoma of liver. What is left? Aflatoxin. Hepatocellular carcinoma. Vinyl chloride. PVC workers.